Public health is all of us working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Epidemiology is kind of like playing detective in the community, I would consider. We work with community partners like schools and daycares to investigate disease and make sure that their sickness is not being spread around in agencies and facilities. Give them education on what they can do to prevent that from happening, to control that spread. Preparedness. Preparedness is ensuring you and your family have plans in place to weather a natural disaster. For instance, we've gone through a rough winter, we've just had some flooding, making sure that you have reunification plans if you need those. A lot of families are at work and at school and at daycare during the day, so just make sure you know how to get a hold of each other. So you have things at home if you need to shelter in place, like prescription medications and food and water. If we have power outages like we've experienced this last winter again too, or even just having stuff in your car, so if you become stranded somewhere that you have those simple items available and you can weather that as well. Our service section offers an immunization clinic, which is open Monday through Friday from 10 to noon and 12:30 to 4, and we provide vaccines for any age. We also do vaccines for children programming, so those that qualify can get free vaccines. We do HIV and STD testing. Again, that's a free service to citizens. We do positive youth development courses at the alternative high school, as well as some other agencies in the county, which talks to teenagers about sexual health and just general life skills, job interviewing, putting an application together, things like that. As well as our preparedness service section, where we work with families in the community to be prepared. We also do a regional aspect of that, where we work with 12 counties in north central Iowa, public health, EMS, and hospitals to work on their preparedness plans as well. And then we have epidemiology, where we work with the schools, daycares to make sure that we keep infectious disease under wraps. We work with environmental health to make sure food is safe and investigate diseases that way. We also do immunization audits in the schools and daycares to make sure kiddos are up to date with their vaccines. We do provide other services as far as TB skin tests. A lot of people come up to our office for that. We also do latent TB treatments, so we can do those services. We've got head lice shampoos and treatments available for the public as well if they qualify for those programs. A lot of diseases out there have minor implications, but if you're not vaccinated appropriately, they can have complicated implications for some people. There's some people out there that are immune compromised, and where they can't receive the vaccines. So they count on everybody else to receive them so that they don't get sick. So that's just very important. It's important that we do epidemiology so that we keep tabs on what's going on out in the community, so we can stay ahead of the game as far as diseases go, and hopefully offer some education and support to the public in preventing that from happening to them. Preparedness is something that we don't see a lot of. It's not always at the forefront of our minds, but when it does happen, we do need to make sure that people are ready so that we can be self-sufficient and resilient to help our first responders as much as we can that way too.